Welcome. My name is Corinne Waldo. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And welcome to this week's cross-industry session with Boulder County Public Health. It is January 14th and we're in 2021. We'll get started. I'm sure there will be a lot of questions, so please put them in the Q&A. Jesse will answer the questions to the best of his ability. If he can't answer them on the session, we'll try to get answers between if there are answers available. But put them in the Q&A. We'll use the chat to push out resources, and I'll ask the questions on your behalf. At this time, I'm going to hand it over to you, Jesse.
Thanks, Corinne, and hi, everybody. I'll jump right in here so we can get to the Q&A part. So just going to do the epidemiological update, state dial status update, and then get into the public health orders. This will pretty much be a review of what we did last week, but I assume there are always new questions, new wrinkles to discuss. So we are at, we're off the peak that we saw in November, which is great. We saw a recent peak in cases after we were moved to orange. We did see a rise in cases, and we're still above where we want to be, obviously, but we're so much lower than we were before that I don't want to dampen the good news with we could do better. In terms of just looking at it across municipalities, again, this is, reported or tested positive cases. And as you can see, we had that peak in November. It's come way down off of that. However, it's sort of stabilizing above where we want to be. I think the key takeaways are case numbers are up and down, so hard to really pin a trend on for us. Long-term care facility cases remain high, but the rate is going down, so that's great. And part of that is the vaccination program. And at this point, this is as of Tuesday, 10,000 county residents have received their first dose of vaccine. And I don't have the number specifically, but I think it's about 300 to 400 folks have actually gotten their second dose already. So that's really great news, and continue to see that program growing, which is good. Okay, so switching to our dial, we are at level orange, which is not backed up currently by our metrics, but we were placed there by the governor, and so we're trying to get our metrics to that number so that we don't see any disruption in that in the future. So right now we're at 353.3 cases per 100,000. That's our 2-week cumulative incidence rate. Our positivity rate continues to be good. It's a little up from last week, 4.3 last week. So we're up a little bit, but it's stabilizing at a good place, it appears. And then our hospitalizations, earlier this week, we were at 11 days of decreasing or stable admissions. We're at 9 days now. So that's not great, but we're still in a good place. And as you know, the hospitalization status has a lot, it changes a lot depending on both the impact of our surrounding communities and our community. So that can fluctuate. Switching gears completely, Corinne, do you want to talk FiveStar program or do you want me to?
No, we can talk about it.
Great.
So FiveStar certification program is a program that was announced in mid-December by the governor as an option for counties to stand up a program locally, not led by public health, but public health had to be involved, in which businesses could then be certified, inspected, and certified to be able to operate one level lower than what our metrics are at. We are currently in the phase right now where we stood up an administrative committee who met last week, and they approved us moving forward with an application to CDPHE using a third-party model, which is a third-party contractor who would help us do a train the trainer inspector model in our community. We have the application complete, and we're just awaiting for final signatures on our support letters from our local hospitals and our county commissioners. And as you know, the county commissioners changed over this week, so we're gonna be getting our final we're trying to get our final approval and support letters from the required entities so that we can submit our application to the state and CDPHE. Good news is that Denver did go before us, and they are using the exact same third-party model as us. And so a lot of the issues or any of the application issues that were found with their application, we've been alerted to, so we can change those in our application. So hopefully it'll be smooth sailing once we submit our application. Please note that we do have an interest form out, and it's important that you fill it out if you're interested in participating, because it helps us understand what kind of resources we need in the number of inspectors, how many businesses are interested in this program. We'll note that even if we get accepted into this program and we inspect a business, because our metrics are currently in the red, even though we're in the orange, a business could not operate any lower than orange at this time until we're 7 days straight showing all three metrics. Those are the 3 dial metrics in the orange. So we're still going to move forward with an application, get the approvals, move forward with an application, and stand up a program locally so that we can prepare for when we do get our metrics down and we are in the orange, and to help our businesses in that sense. So in the chat, I will put in the interest form. So if you are interested in participating, we can get a good sense across the county of how many businesses would be interested in a FiveStar program. And I'm happy to answer any questions. The application, so if we submitted an application to CDPHE as early as next Tuesday, we would maybe take pre-applications or applications as soon as we get approval. And the turnaround time from CDPHE has been about a week. So we may be accepting applications or pre-applications as early as the week after next. As soon as an application goes in, we can schedule an inspection pretty quickly as long as your application is approved. So we're talking in the next couple weeks. So I'll take some questions on it later, but we'll go on with the presentation, and I'll look at the questions that come in from FiveStar and answer those questions later in the program.
Great. Thanks, Corinne. So I mentioned the vaccination program earlier. We are still in phase 1A, and we expect 1B to begin before the end of January. There have been some 1B vaccinations as far as I understand it, but that's been very limited, and it had to do with a lot of availability questions. In terms of phase 2, where a lot of our essential businesses fall, teachers, folks like that, that's likely to begin in March, and we don't have a date or anything like that yet. It really has to do with the availability of vaccine. Our programs, our vaccination sites, hospitals, and some of our outdoor drive-through vaccination sites have been capable of taking more vaccine and distributing more vaccine than has been delivered to the state at this phase. And this is information I got from the public session that happens on Wednesdays, which I encourage you to go to. That's led by our public information team. There are 60,000 doses coming into Colorado every day, and those are obviously distributed across the state. So there are not that many doses coming in right now, and so it's really a supply chain issue. But the partners we have through our health partners, as well as our public health vaccination sites, have been really effective at getting vaccines into people's arms. In fact, one of the things I wanted to know that I thought was really interesting from the conversation yesterday is it is very hard to refreeze vaccines once they've been thawed for distribution. And as yet, Boulder County, at our partner sites, at our sites, we have not had a single vial of vaccine go unused. So we are getting that in arms. We're running down the list trying to get everybody vaccinated. So that's going as quickly as we can, while being safe.
Jesse, before you move on, I think it's important to, because we've already had a couple questions come in about this, to note, who falls in 1A, who falls in 1B, and who falls in 2. And and then the prioritization of the 1B
Yep.
above and below the dotted line, and I put in the vaccine notification sign up link into the chat.
Perfect.
So if you could just maybe go into a little bit more detail about those pieces, we
Absolutely.
can answer those questions right now.
Yeah, absolutely. And you may know a little bit more about the dotted line. I still am unclear on how the dotted line works, but so 1A, as we've discussed many times, are our frontline healthcare workers. They're the people who are directly engaging with people who are COVID positive. And so they are our first line of defense, and they are the people who are most impacted directly by COVID-19 possible exposure. 1B is intended for those people who work in professions or who live in settings that are hotspots. And so long-term care facilities, that's a thing that changed last week. The governor, I believe it was last week, yeah. The governor made the announcement, nope, it was right before New Year's. So 2 weeks ago, the governor made the announcement that those 70 and older would be in 1B. And then frontline workers in various other fields would also be in 1B. And frontline is an interesting, a lot of businesses have been contacting us, and I'm sure they've been contacting Corinne, essential businesses that are in the public health orders considered essential and have some breaks from public health order requirements, are not the same as frontline businesses. Those are different things. And frontline, if you go back to how 1A is defined, frontline workers are those who are likely to be exposed to people with COVID-19. So there are people who work in essential businesses who are providing services to our whole community and doing this under incredible strain and in dangerous conditions, all that kind of stuff, but don't have regular contact with people who might have COVID-19 outside of, while they're at work. And those people are not considered frontline workers. They're still considered essential. The dotted line is where I get a little funny here.
I can talk about it if you want.
Yes,
so
awesome. Please.
All right. So on the 30th, the governor expanded what 1B included. So just to give everybody a sense, 1A and 1B, that's the first two levels of the vaccination, incorporate 1/3 of Colorado's population. So if you start to think about 1/3 of our population now fall into that 1A, 1B category. Expanded 1B to include anybody over 70, teachers, grocery workers, essential manufacturers, postal workers, public health workers, and so forth. And then there was a clarification made that, because as we saw, you've probably read in the news, we had some of the school districts go out and start to immunize some of the teachers and so forth. They created a dotted line into that 1B category. I had essential manufacturers reaching out going, how do I get immunizations for my manufacturers? And it was clarified that anybody above that dotted line had to be immunized first before anybody below. And above that were essential healthcare and long-term care and 70 plus. In Boulder County, there are over 30,000 people over the age of 70. So those individuals will have to be immunized first before we move on to our essential manufacturers, our teachers, and so forth below that in the 1B. I put into the chat, and this is from the governor's office. This is in Boulder County Public Health. These are direct orders from the governor's office to the facilities that received the vaccinations. Emailing me is not going to move you up on the vaccination list. I've gotten that request a couple times. But I put in there information on everything that the Boulder County Public Health has put out on the vaccinations, as well as a notification sign up for the categories within 1A and 1B, so you can be notified when your group is up, when it's time for those teachers or those essential manufacturers. And by that time, they'll probably have figured out how to get maybe some larger employers signed up or some providers for that. So, and then phase 2, we can talk, does include some of our essential retailers. And by the time we get to that, there'll be probably some more clarification around that. But I know there's been some questions that came in about it.
No, I really appreciate that clarification. And I want to reiterate exactly what you said. Neither Corinne nor I can get you on a list or can move you up. In fact, I think both Corinne and I talk to our vaccine teams pretty regularly and to the higher ups in public health. And what I will say is that when a plan is made at the state level, the operationalization of that happens at the county level. And our teams are figuring out how to make this happen. And so contacting us and saying, how do, can I sign my whole business up? Do my individual employees need to sign up? What if I have people living in other counties but working in Boulder County? Those questions are all being sorted out right now. And we will let you know through as many avenues as we can the answers to those questions as soon as we know them. We, the one thing I will say is please keep contacting me at least. Don't contact Corinne. She's got enough emails. But we want to be able to communicate with you, and we know that this is stressful and confusing. And so contact us. We will try and get you the right information. But just know that it's our goal to get that information out to you as soon as we know it. We're not holding anything back. We're not keeping anything from people. As soon as we know the answer, we'll let you know through avenues like this, through Corinne's emails. So definitely take advantage of the notification system set up by Boulder County. There's also, if you believe you're in 1A or 1B above the line, there is a way to sign up on the website. You have to self-identify as a healthcare worker, and it's a Survey Monkey link that you have to go through. Definitely take advantage of it if you fall into those frontline workers or healthcare worker areas.
And some of the hospital systems have been great. I know, in our local area, Centura, BCPH, Kaiser, they're starting to alert their 70 plus, their clientele that are regulars within those hospital systems about getting vaccinations. So please know that those it's through the hospital partners as well. And so there's a lot of alerting and plans being put into place once the prioritization was recategorized last week.
Yeah,
2 weeks ago.
Yeah, and I would just say again, we're trying to get information out as quickly as we can. The state also provides a lot of information on their website, and it's subject to change. I mean, as conditions change, they'll update their website. We will update ours, and we'll put out press releases. We'll work with Corinne, all that kind of stuff. So we'll get information out as soon as we can about vaccinations and the phases we're in. Okay, so moving on, and I will try and go through this relatively quickly. We're just going to talk about level orange, where we are, and what that means. This is a review for the last couple of weeks, but I think it's good to just keep on hitting on this. So we are at level orange. The second bullet here is just my warning to everyone, but again, our metrics have been tending in the right direction. So we should keep that in mind as we go about our business, that we do need to actually attain level orange to help our businesses. So let's work in that direction. So level orange reminders, capacity levels for most sectors increase to 25%. Retail remains at 50%. Manufacturing may operate at 25% or 50 people, whichever is less, per room, per 4 walls and a door, for your larger manufacturing spaces. Personal services and limited healthcare can operate at 25% or 25 people, whichever is less, per room as well. Gyms are 25% or 50 people per room. And this is a change. We've been talking about the last couple of weeks, but yeah, it is a change from before in 2020, the end of the year, it was 25 people per room. So this is quite a few more people are allowed in. For restaurants, and this is where the 50 people comes from. For gyms, they wanted to make them equal. For restaurants, 25% or 50 people per room, whichever is less, 10 people per group outdoors at tables, and on-premises alcohol sales until 10 p.m. For indoor events, 25% or 50 people, whichever is less, and then you need to be using the social distancing calculator. And remember that seated events where the majority of the activity occurs seated, you can have slightly more people because what you're doing is ensuring that households are more than 6 feet or 6 feet or more apart. And those are all masked. Remember that anything indoors needs to be masked. I dropped the mask order reminder from here, but remember that indoors activities need to be masked. Open houses, which are part of our field services sector, need to follow indoor events guidance. For outdoor events, same rules as indoor events, but they can go up to 75 people if the space is large enough to maintain that social distancing. For sports, indoor organized sports are not permitted. That includes practices. Also, I want to note that right now, the county has instituted a no spectators rule that will last as long as we are in level orange, or if we go to level red. So no spectators are permitted at any sporting events in the county. Outdoor sports, 10 or fewer on a field, social distancing must be maintained and everyone must be wearing a mask. The caveat to all of that, there are select sports that CHASA, the Colorado High School Activities Association, oversees. So I'm not going to list them all because I'm going to miss one. But if you have questions about that, you can check online what sports are in season B. They can begin practices indoors and outdoors on January 18th, and then matches begin in February. And anybody who's operating one of those school sports knows that the outbreak guidance needs to follow school guidance, and that's specific to those schools, so don't want to get too much into that. Small business grant program, I updated this a little bit because it's now open. That's my understanding, at least. And this is limited to restaurants, bars, caterers, movie theaters, and gyms. There are a couple other eligibility requirements that you may want to check on. Applications are good until the 29th, are open until the 29th of January at 5 p.m. And this, the link I have there is the direct link to the website for those for that grant program. So definitely check that out. I assume since I saw the email this morning from Corinne, I know it's in there. So definitely check that out. I already gave that vaccination update. Exposure notification system, just a reminder, please sign up for this. It'll help you track if you have been in contact with anyone who subsequently tests positive for COVID-19. Really useful tool for protecting your family and those you work with. Our business sessions, obviously, you're here, thank you. Thursday, 1 p.m. is our general updates and guidance, and then if we need a session for a specific sector, we will have them on Fridays at 11. Our Spanish language sessions, which are done in cooperation with the Latino Chamber, are released. They're recorded in advance and released on Thursdays. And then that's how to contact us. If you have questions or comments, please use covidbiz@bouldercounty.org. If you have complaints, you can contact the number, the call center there, and they can help you out. So with that, happy to take questions.
Okay, we have some questions about vaccinations, as you can imagine. There's some questions as to where restaurant workers would fall into the vaccination priority list, if they're considered frontline essential. Are they considered essential? Are they going to be in the general public? I think we've gotten the question about fitness instructors as well.
I don't have a specific answer for that. I would check the website, Lane. I don't know if you have that. I can probably pull it up on here.
I have it up right now.
All right.
Well, it doesn't specifically say restaurant. It says frontline essential workers in education, food and agriculture, manufacturing, postal service, public transit, specialized transportation, grocery, public health, and essential human services fall under 1. Under 2, it says other essential workers and continuity of local government. So it doesn't specify, and I'm not sure if restaurant, and I know that Unfortunately, gyms do not fall under the essential businesses or workers. So at this point, they fall under the phase 3 component.
Right.
Yeah, this has been a super big challenge. It's been a moving target and been changed by the governor multiple times. But I think that larger group of essential work, all they've really said is more is going to be forthcoming. So really, it hasn't been fully vetted. So it's not a guaranteed no, but it's certainly not a guaranteed yes. I mean, I think the ones that have been identified so far within the retail food world are grocery and some of those others, and then certainly manufacturers of food, but restaurants have not been named in that listing. So, so as of right now, we still don't know if they'll fall under that phase 2 or if it'll be more under the general population.
And then there's a question as to what's the difference between, for example, a frontline manufacturing worker who's in an essential manufacturer versus an essential manufacturer. And I think you tried to answer that earlier, but do you have any more clarification on that?
I mean, I can provide a little bit more clarification, but I will say that is also a question that's not, frontline is not defined anywhere. So what I'm doing is I'm extrapolating from what frontline means in 1A. And so my suggestion is if you have workers who are regularly interacting with people who may have COVID-19 and they're essential workers, essential manufacturers, then those people may fall into 1B. What we're seeing a lot of is people who are in essential manufacturing, but their exposure is the same as anyone else's exposure. They're being exposed at work. They're being exposed to the choices they're making outside of work, and those people are not frontline. Their jobs do not require them to interact with people who have COVID-19. I think that's the break.
So they might fall into the other essential workers that falls under the part 2. I think this is still a moving target, as Lane said. Again, the state has to vaccinate anybody 70 plus and the people above the dotted line. And I think as they move to that next level, there will be some more clarification. And some of the industry associations have already reached out and we're trying to get more clarification within some of those industry associations to help guide, for example, manufacturers in this process.
The one piece that I think have some clarity on is you may work for a manufacturer, but if your job is working remotely, those would not be staff that qualify. So as Jesse talked about it really would be people that are showing up and interacting with other folks that potentially do qualify. But if, again, you work for a company that's essential, but your job is remote, those staff would not be ones that qualify to get into those would be people that would be moved into more of the general population.
Okay. So a couple questions about the grant. So somebody asked me to put the grant application into the chat, which I did. And there was a question as to whether dance studios, yoga studios, and all those fit under gyms. And one of the questions in the grant application is your NAICS code, your NAICS code. I've gotten a couple calls about that. I can't believe they're even asking that question, actually. And that's really your classification code under the federal database. And really, those gyms, yoga studios, dance studios, they do fit under the same NAICS code as a gym. So I think the intent was for yoga studios, dance studios, and those were the facility to be able to apply for this grant. So that should answer that. And if you're curious what your potential NAICS code is, you can reach out to me. I can, if you don't know it, it's probably in the 713940 category, if you want to take that down for those gyms out there. I've looked it up a couple times if you can't tell. So we have a couple questions about capacities. You mentioned the seated capacity for events versus unseated. And I think we need to clarify because you said you can have a higher for seated, but that's still not above 50 people.
No, yeah.
It's just that it's It's just that if it's unseated, you have to use the calculator to figure out the number because you have to have that distance. But what's the maximum capacity for a seated event?
So it is still 25% or 50 people, whichever is fewer. You know, you're still limited to that 50 people at most.
But when you're standing up, you have to have 144
right.
square
So
feet
that's
around
going to be
people.
lower, right? Yep.
Which could be a lower number for the same amount of space because people need to be able to move around. But when you're seated, you could have a higher number in that same space because people aren't moving around, which I think is the clarification we needed to make.
Yeah, I think that's a really good, thank you, Corinne. Thanks for mentioning that idea, because I think that, yeah, use the social distancing calculator and consider, or consider it this way. If you use a social distancing calculator, that is looking at 144 square feet around each person. If you're looking at if you're just saying, how many people can I fit in here? Up to 50, everyone's seated. What you need to do is 6 feet on a seat, like the next person has to be 6 feet away from a group of people. So you could have a family, which would obviously, you know, that's 2, 3, 4 people, and then 6 feet away can be another 2, 3, 4 people. Whereas if you use a social distancing calculator, the idea is each of those people that's 6 feet away is an individual as opposed to a family. If that helps clarify that.
Thank you. When that question came in, I realized we probably need to clarify that a little bit. Back to the vaccination question, you mentioned this. Should they sign up in the county they live in or the county they work in?
I would sign up in the county you live in. However, that is a question that the governor is apparently looking. When I asked this question of our vaccine team earlier this week, they said the governor is making an announcement about this. So we haven't seen anything yet. So I expect sometime soon we will get clarification on that. But I don't think there's anything, and Lane and Corinne, correct me if I'm wrong here, but I don't think there's anything wrong with you signing up in Boulder County if you work here, just to make sure. That clarification will come at some point, and we'll also be looking at that as we go through those lists.
And it's a lot dependent on what group you're going to fall under. So if you're kind of one of the high risk, if you're 70 and over, certainly within the county you live is where you should focus on. If you're one of the employees on a critical business, it probably makes sense to focus on where you're employed. So it's a little bit dependent on obviously which category is going to get you vaccinated sooner. I'm sure that's kind of what everyone's goal is. And so we're not looking to certainly bar anybody because you work in one county and live in another. So again, it probably will be very dependent on which one is going to facilitate you getting vaccinated sooner. Just obviously you don't necessarily want to be getting different vaccines. So it is important that if you start with one of the providers and it's a 2 series, you need to follow through with that same series. So that's the one big caveat if you're potentially getting vaccinated through multiple locations, that vaccine that you do get is important to make sure that you're consistent.
And don't just show up someplace expecting a vaccine. Make sure you follow through with the same brand of vaccine as well. I've heard some stories of people, choosing to say they're in a different profession. I think we just look at the different websites, sign up for your alert, and then, ask the questions that you've been asking. But I think as more clarification comes out, we'll push it out to the public and to the groups. What has the effect been of the new variant of the virus? Has there been any? What's the conversation?
So I don't know, Lane, if you have more background on this. I did see in the paper this morning that they have identified one resident of Boulder County who has the more virulent version. And I think, from what I understand, the key is it is more virulent. It's not necessarily more deadly. It just means that it is easier to be infected by it. So that just reinforces the wash your hands, wear a face covering, maintain social distancing. That's how we combat this. It's the same for either variant.
Yeah, we're expecting increases in disease in the community based on this additional strain. It should not, I think, have an impact on the vaccine though. So that is very positive that it has not mutated to a point where we're gonna really jeopardize our efficacy. But yes, we are very much concerned that there's going to be greater disease spread. So it is important for people to really sustain all of those practices Jesse mentioned.
I have a couple 5-star questions, but I'm going to wait and do those all at the same time. We have someone who mentioned that they heard of a restaurant owners renting the parking spaces out in front of their streets to expand their patios and restaurants. This has actually been happening for months. This is something you'll need to check with your municipality about. This is not something that's governed by the county. It is something that your municipality has probably worked throughout the last couple months, some sort of right-of-way expansions for businesses. So check with your municipality to see what their policies and their practices have been and how a lot of it was done over the summer, but some have expanded that through the winter months. So please check with your municipality on those. I think that's, I mean, you guys are, yeah. You don't cover any of that.
Nope.
Okay. So if we're expecting increases in the virus numbers due to the variant, does that put our level orange at risk?
Absolutely.
Yeah.
Okay. If you're in the process of hiring, would you recommend new employees get COVID testing even if they've completed vaccinations, or should they get COVID tested before they get hired?
I mean, I guess it depends on the occupation, but in general, we're not necessarily encouraging all businesses to have their employees tested unless there's, you know, a way for them to sustain that testing, because just a single test doesn't really tell you a lot other than they're not sick at present time. And then once people are vaccinated, it's important for what type of test is used. So again, once people are vaccinated, they're hopefully going to start to build antibodies. So that isn't necessarily the type of test you want to do to determine if you're actively sick. So again, it's a little dependent on what possibly the occupation is and the ability to sustain testing. But certainly when people are ill or if there's any concerns of exposures, then those are the times when people really should get tested. But as far as just as a tool for part of your interview process, I don't know that there's as much value added there.
This brings up a really good point, Jesse, and you and I were talking about it beforehand about employee health checks. We are, I don't know, 10 months in, and you know, I'm getting calls again. I have an employee who's sick and I need to do contact tracing. I stopped those employee health checks a while ago. Do I still need to be doing those? What's the answer to that, Jesse?
Yes, absolutely. It is imperative that, and I guess I'll just go on a digression here. I know we're all sick and tired of this. It's hard, but all of those measures are still required by the public health order, and they are the best way to keep your employees safe. Knowing as they walk in the door, whether they have an elevated temperature, a cough, a fever, all those sorts of things are going to help you keep your employees safe. So please continue to do that. There are tools online to help with it. People have developed apps to help with it. Take advantage of the sort of blossoming of technology that's helped with this, but really we have to keep doing that.
And I even got a question this morning, like one of my employees was exposed, but their doctor said they have a fever, but it's probably just the flu. Can they come back to work?
No. And I know that it is very easy to talk to a family physician, a virologist, anybody who is considered an expert and who can tell you, well, the chances are blah, blah, blah. The public health order is clear. As a business owner, it is your responsibility to check your employees and to bar entry to any employee who has any of the symptoms. It's really for their safety as well as the safety of all their coworkers and any customer. So it's really imperative that we keep sticking with that.
Well, and if you did have an outbreak, and this came up this weekend, the clearer your records are, the
Yes.
better your records are about exposure to other people and your health checks, the easier it is going to be for the EPI staff to be able to reopen your business, to figure out if there was truly an outbreak at your business. I mean, it's going to be, the better your records are, the better it is for your business moving forward too, correct?
Absolutely. And you know, without naming specific businesses, I will say that, you know, we were talking about a specific business that kept great records. I was involved in a small investigation with another business that they were able to identify where employees were when and whoever interacted with other people. And that meant that they were able to isolate the people into quarantine. Sorry, I shouldn't have used the word isolate. They were able to quarantine the right people and keep the business open, providing vital services to the community. So exactly so. Keeping records really helps.
Okay. All right. So the rest of the questions right now are about FiveStar. At this point, I'll answer a couple of those. I put the pre-registration form, or it's not pre-register, it's an interest form for FiveStar into the chat. This is our way of knowing if you're interested in the program, what resources we're going to need, and so forth. So there is that. I did get the question again about how soon we would be able to open applications, and then I got the question, why the delay? And I want to take a step back and say that this is a very resource heavy program, and unlike some other counties, we have 8 cities, 8 municipalities in this county that had to review. We have 5 hospitals, we have county commissioners, as well as 2 school districts, and a lot of interest in this program. So we're navigating we're navigating both sides, because we're navigating the political waters on both sides. We're trying to get all of the sign-offs from all the hospitals. And just a note that the county commissioners also changed as of Tuesday of this week. So we had approval to move forward with the administrative committee. We formed the administrative committee last week. They said, move forward with an application. And then Tuesday of this week, we have new county commissioners and have to get a new letter of approval on the application from the new county commissioners. And that has to be in a public meeting. That public meeting is next week. So just know that as this is going on, we have the application prepped. We are working through with our third-party vendor all of the issues that came up in the Denver application. So we would have had some back and forth with the state, and we know what those are, and we're working through those, and we have a brand new, we're going to be able to push those forward. I understand there's some concerns about the delay, but please know that many hours have been put into this, and we understand that a lot of businesses want us to push this forward, and we're working through every one of the political barriers that have been put in front of us. As soon as we can, we will submit an application. I'm working with every legal team at every hospital right now to try to get a letter of support from the 5 hospitals. So please know that this has been a priority on my work plan. Lane can tell you I didn't get much sleep over break to try to push this forward, and I understand there's some frustration. We're trying to get it, but even if we get acceptance today, it doesn't mean you can operate at yellow, because our numbers are in red. So we're going to get the infrastructure in place. We're going to get inspectors trained. We're going to get the application process ready. It's all built. Everything's built. We got to get inspectors trained. We're not going to be able to allow you to operate in yellow quite yet until, as a community, our metrics hit orange. So even those communities that have 5-star certification, every community except for Broomfield that has 5-star certification, their businesses can't operate any lower than orange right now. So I just just wanted to say that I understand there's frustration, and I know the way the question was worded that that yes, we keep saying ifs, yes, we keep saying approvals. There have been a lot of barriers that we're trying to overcome. So, Lane, I don't know if you have anything you want to add.
I guess I would just say that even if we had the program in place, you wouldn't be operating any different than where you're allowed to operate right now, because our metrics have been in the red. And so we haven't met the qualification for people to operate in yellow anyway. So there really, even though there has been delays that we wish hadn't been there, it hasn't actually prevented anything to this point. So it's not like you would have been able to operate in yellow this whole time.
And I understand that you're, and then, you know, and the follow-up question, I understand, believe me, I think I've talked to 100 restaurants in the last 3 weeks and quite a few gyms who I understand how frustrating this is, that your incomes are being impacted. The shutdowns have been, I really empathize. And so that's why we're working as hard as we can and your incomes are impacted. But as Lane said, at this point, I wouldn't even be able to allow you to operate in yellow at, you know, under the FiveStar program, and the administrative committee wouldn't either. So we're doing as quickly as we can to get the approvals, to get it in place, to get the infrastructure up, to do the inspections, because we could have thousands of businesses here in Boulder County that apply. So we need to be prepared for that as we go, which is why it's important that you fill out the interest forms. So we have a great collaborative of all the municipalities, the chambers, the economic developers. Lane Drager sits on for Boulder County Public Health, you know, that have come together, and we're working together to try to put this in place for our community. So, and we'll continue to send out the information, and as soon as we get approval, we will set out a press release and start taking pre-applications. All right, so I think I answered all the FiveStar questions that came in. If you work in an office with plenty of space, do employees still have to wear a mask at all times at a desk and cubicle, even if there's 6 feet of distancing?
Yes, absolutely. So the mask order is still in place. You need to be wearing a mask if you are indoors in a public space, and that's any business is a public space. The one caveat to that is if you are in an office by yourself with the door closed and 4 walls that go floor to ceiling, completely separated from every other space in the building except by that door, then you can take your mask off. But if you're in a large space with cubicles and or half walls or whatever, you need to keep your mask on at all times.
And then what about if we're eating or drinking in that office area?
Eating and drinking, you're permitted to take your mask off. You need to be 6 feet distant from everyone else. And we recommend, you know, that there are ways to deal with this. One thing, you know, obviously the weather's not great for it, although it's been pretty good yesterday and today, if you discount the wind. Eating outside is obviously much safer. And then also having break rooms available where one person can eat at a time, that sort of thing is helpful.
Okay. Do you have any sense of where we might be in the summer on the dial? If the summer might look more normal?
Nope.
The hope is we've certainly progressed quite a bit in vaccination, but as far as, you know, what's going to happen with disease incidence, that's a human nature question as much as anything. So it really depends a lot on people's activity and how much people continue to spread the disease. So, and certainly we hope that we don't see, you know, any additional strains come into Colorado. But, you know, we certainly are expecting that the strain that we have now that has arrived is going to have some more impacts.
All right, are there any other questions out there? Oh, and thank you for those of you that are filling out the interest form right now. I'm getting those right now. So we have a question about, okay, I'll answer the NAICS code question in just a second,
okay.
but can you talk about how many people have currently been vaccinated in Boulder County thus far? And then, you know, you mentioned something about number of vaccinations. I think
Yep.
you need to clarify what that 60,000
Yeah. So,
was.
and I apologize. I threw a bunch of numbers around. I should have been more cautious about it. So, as of Tuesday, we were showing that Boulder County had 10,000 first doses issued, vaccine distributed is the word I think that I want to use. The 60,000 number that I mentioned was an estimate of the number of vaccine doses that are coming into Colorado every day. And those are being distributed around the state. So 60,000 has nothing to do with Boulder County. It's how many vaccine doses are entering the state and being distributed throughout the state every day. The 10,000 is from when we first started vaccinating, which was mid-December, late December, to now we've been able to vaccinate 10,000 people with the first dose. And
there's an additional 1,700 plus that have a full course that had both vaccinations. So it is I think I know our vaccine kind of lead, it said we're over 12,000.
Oh, great. So that's actually a huge update, because I think I said 400 or something had gotten the second dose. So that's great.
So, but yeah, the challenge is 60,000 coming into the entire state, getting divided across the state. And then with the different populations and groups that have to get hit, where the amount coming in is not enough to get to all the groups that we need to, or at least not in a speed that we would like. So, you know, again, the hope is that we'll see more vaccine coming in.
So another question came in about finding NAICS codes, and I just put in the NAICS code lookup link, as well as where you'll find the gyms and restaurants. And now the question was about venues. So while you answer the next question, which is Boulder County Public Health holding back second doses, or are they using all the doses they have and expecting the second dose will come in on time? So how are you prioritizing making sure you have the second dose for individuals and then additionally new doses? While I look up the venue's NAICS code for someone.
Yeah, I know we're not stockpiling vaccine to get people the second dose. That being said, when people are ready for a second dose, that will be another group. So again, it's going to continue to be a delay for those folks that are in lower categories.
It didn't take long to answer that question.
I don't know. So I think under the NAICS code lookup, I would look up an event venue, and then just try to find the one that best. There's you know, sporting events, and there's other ones. So I would look that up. Look up what best fits your business. In most cases, you've been assigned an NAICS code when your business was formed, but try to find the one that best fits your business under the NAICS code lookup tool that I put up. It's the first link that I put into the chat. If you have issue not having enough qualified individuals administer vaccines, and I think it's important to also mention how many people it takes to run a vaccine clinic too. Quite a few.
No, I don't. The delay is not based on our ability to do vaccinations. It's a delay because we just don't have enough vaccines to provide. So that's not why it's taking so long. It's just, again, the amount of vaccine we're getting is nowhere near the amount of people that need to be vaccinated. You know, I think there was over 30,000 people that are 70 and above. So when you look at that and figure population wise how much vaccine Boulder County is getting, you know, it's that group alone is going to take a long time to get vaccinated.
So I think there was confusion, Lane, on what you said. Are you saying that people aren't guaranteed they're going to get their second shot in an appropriate timeline?
No, that's not a concern. It's just that will further delay people that are in other groups. So.
And then there's a question that came in about what are some of the common primary requirements for businesses to be 5-star certified, so they can start preparing. So if you go to the 5-star site, which is, I think I put into the email today, the basic items, the basic main items that are in the certification are listed under the state site under the checklist. But everything that is in the 5-star certification program are already in the orders. Things like, employee health checks, making sure, it's just going to look at some of this stuff. Making sure that you, if you need to require reservations, that you have those reservations, that your bathroom stalls are, you've cut off bathroom stalls that are, no more than 6 feet apart. Employees know that you have the right cleaners, putting signs up, all the required signage that you have to have up, the mask signage, all the signage that in the emails I sent, we have actually created most, if not all the signage for you. It's in the signage links that I put in there. Having sanitizer, cleaning common use areas, putting signs up for social distancing, wearing masks, cleaning, the stair handrails, all of the areas that are, cleaning common use areas, doing the employee health checks, putting up your signage, making sure that you have a way to capture people coming into your facility, those types of things. So I think there's some concern that it's going to cost a lot of money to do this. It's really not. It's doing the things that are already in the order, making sure that employees and others know about the notification system, and you're promoting the notification system, giving options to individuals to be able to shop alternatively or have alternative hours, those types of things. So on the 5-star link are the basic items, and then anything additional to that would be just items that are already in the order. One area that might cause confusion, and we'll be creating videos around this, are the HVAC requirements, and we'll be creating videos around that. And those just mainly have to do with airflow and filters, but there is a link on the state site having to do with that. So thank you for the question, Emiliano. We'll try to get as much of that information out as possible. Any other questions? All right. So without any further questions, we don't have a special session on Friday of this week, but if there are any updates for any of the industries, or if we have any updates about grants or licensing or orders, I will send that out. Otherwise, please do not hesitate to send questions into us. And we will see you next week, same time, same place, same group.
Thanks, everybody. Thanks, Corinne.
Thank you.